Willie D Live.
What's up, family? If it's your first time checking out the show, let me know what city, what state you're coming in from. If you're outside of the U.S., let me know what country you represent. Throw up your flag. Family, I need you to smash up the likes, smash up the likes, smash up the likes. Also, if you have not done so already on YouTube, after you subscribe, there's a little bell next to your subscribe button. Go ahead and click that thing right now so you can get your notifications each time I drop a new video like this. That way you'll be in the loop, going straight in. Family, we've spent weeks asking whether the medical examination in the Nolan Wells case can be trusted. Now a forensic pathologist is weighing in on the professionalism of Mississippi medical examiner, Stacy Turner. Yes, Stacy, we see you. You are in the crosshairs. Right now in the studio, I got Dr. Jane Thompson Gorniak, who is going to help us kind of navigate through this autopsy process. There she is. That's a good doctor. How you doing?
Hey, good afternoon. I'm good, thanks.
Great. I want to save the grade for a little bit later. So first question I want to ask you is, what is the biggest difference or the biggest forensic red flag you've seen in this case?
I can't say that I saw any red flags. As a forensic pathologist, I know how the process goes. So if you don't know a forensic pathologist, have you not talked to anybody about an autopsy process, some of the things that we do might be confusing or out of the ordinary. I haven't seen either the first autopsy or the second autopsy report. All I know is what your viewers and myself have seen, on social media or in the news.
Why would Nolan's lungs be retained after the autopsy?
Well, I have since learned that they were not. They were not. The whole lungs were not retained. The lungs were sent with him for the second autopsy. I'm not sure where that information is coming from, but I have since heard that the lungs were there and the stomach. So, like I said, I haven't seen either autopsy reports, but sections of each organ is saved. That's normal process of an autopsy. Anytime we do an autopsy, we will take a section from each organ and save it. We call it a specimen jar. And depending on the jurisdiction and the size of the office, we will save that for a year up until 3 years. That's because once the body leaves the autopsy room, the medical examiner, coroner's office, it goes to wherever. It goes to the funeral home. The body might be buried, the body might be cremated, or it might be going for a second autopsy. So once we release the body, if we ever need to go back and look at tissue underneath the microscope, that's why we have that, because once the body leaves, we can't retain any other organs. So I believe there's sections of the lungs, but not all of the lungs were retained by the medical examiner in Mississippi.
Okay, so this is new information to me, because the entire time, the only reports that I've ever heard was that the lungs were retained by the medical examiner, the Mississippi medical examiner, the lungs and the throat. Why would that's what I heard, and okay. That's what I've seen. I haven't even seen any report contrary to that, to this. I mean, this is the first time that I'm hearing this.
Well, the neck, I did not find that alarming that it was saved. Like I said, in all autopsies, we can save specimens. And it depends on where somebody trained or how they do in their autopsies. For example, someone might save in a drowning or strangulation case, someone might save the whole neck structure in that specimen container. When I do autopsies, I save the hyoid bone in all my cases, regardless if it's a gunshot wound, a drug overdose, a drowning, or a natural death. I save that because that's what I do in all cases. In some cases, will I save the whole neck structure? Possibly, but it depends on what I see at the time of the autopsy. So this doctor might save routinely might save the neck organs routinely. I don't know, but it's there. It's at the office in a specimen jar. And I would have no doubt that if Dr. Mitchell wanted to see what was in the specimen jar, they would allow him to do that. The thing is, they can't send that because it's biohazardous, right? We're saving tissue from a deceased body in what we call a fixative solution, which is formalin, right? Which is toxic, right? And we would never want to just send that willy-nilly. But that specimen jar needs to stay at the office. That is their property, their evidence that needs to be stayed there. So if somebody wants to come look at it, they can, but they won't send it. They won't send it out.
Right, because something suspicious have been found.
Well, not necessarily, right? And it's possible, but it's nothing. I don't want to say something suspicious was found, right? But something may have been found, whatever that is, whether it's suspicious or not. Was there an injury there? I don't know, because I haven't seen the original autopsy report, right? That doesn't mean, like, for example, like I said, if I see something that's an injury or even a tumor, right? So I do an autopsy and I see someone has a tumor in their liver. I'm going to save the piece of that liver with the tumor in it for later, right? Just in case anybody asks me, because I'm going to take a photograph of it, and I'm also going to document it in written form. That's another thing. Photographs are taken at the time of autopsy. So there should be, and I don't know if you know, I worked with Dr. Roger Mitchell, the physician who did the second autopsy, and I learned from him, you can't take too many pictures, right? So when I do autopsies, you're going to see a picture of everything, even what we call negative photographs. So like I said, the hyoid bone, which we can see is a little bone that sits way up in your neck, it might be broken if someone is strangled. I take a picture whether it's broken or not, right? So the negative photograph, so if anybody can say, oh, well, you said his hyoid bone isn't broken. Yeah, here it is. Not only do I have it in the specimen jar, I also have a picture of it. So there's more documentation than just what is written, or there should be. Once again, I haven't seen anything, but as forensic pathologists, we should really be documenting not only in written form, but with photographs. And photographs, I mean, I don't think there's been any better evidence than a photograph. And so you're just not taking my word for it, if that makes any sense.
Right. It makes a lot of sense. You got a lot of people who are saying what does not make sense is that you got these guys who are supposed to be Nolan Wells' friends who go out on a boat trip and everybody come home except Nolan. And then you have this suspicious sea tow call of the sinking boat. And you hear clearly people in the background on the phone call in a panic. They're making statements that's consistent with something bad happening to somebody, right? Nolan, oh my God, is he dead? You know, all of these, you know, people are saying, you know, you hear the words, you know, are we going to, you know, can we cover this up? You know, you hear all of this stuff going on. So people, there are a great deal of people, I do believe the majority of people in this country believe that that was foul play involved in Nolan Wells' death. You know, let's say drowning was suspected though. What evidence should the autopsy show?
Okay, before I answer that question, I'm going to say there's a difference between cause of death and manner of death. So the suspicion and the foul play lends to the manner of death. The cause of death is the injury or illness that caused somebody to die. And that could be the drowning, that could be a drug overdose, it could be a gunshot wound, right? So that's what the body is going to tell us. So in a case of drowning, we call that a diagnosis of exclusion. So you just can't say this person came out of the water and they drowned. We can't say that. We're going to do an autopsy. We're going to look at everything and we have to rule everything out, right? Is there any trauma? Some people say, was he dead before he went in the water? Possibly, we may or may not be able to tell that depending on what that cause of death was. The thing is, in a young person, he's 18 years old, right? No medical history. I don't expect him to have had a heart attack. I don't expect him to have had a stroke. So if he was dead before he went into the water, we would have seen, not we, forensic pathologists would have seen a cause of death at the time of the autopsy, whether that was a fractured hyoid bone, whether there was, like I said, because he was strangled, whether something was in his mouth and he, asphyxiated, meaning he couldn't breathe, or he had severe trauma. We would have seen that at the time of autopsy had he been dead before he went into the water. But once again, drowning, a diagnosis of exclusion. So we are going to look at, like in any other autopsy, are there any signs of trauma? Are there any signs of natural disease? People could have a heart attack and die in the water, right? Someone could have been shot and thrown in the water. But so we would have to exclude those things. In a drowning at autopsy, we see what we call soft signs. So we look for things like, is there water in the lungs, right? That could be because somebody was not only, they're inhaling the water, so the water is going to be in the lungs. And of course, if you have water in your lungs, the blood can't circulate, the oxygen can't circulate through your body, and that's why you die that way. So we might see that. If we don't see water in the lungs, doesn't mean they didn't drown. Once again, a soft sign. Another soft sign that we can see is water in the stomach. Your airway and your esophagus are very close to each other. So, your epiglottis, right, closes on top of your airway. So when you're eating, that's why they say don't talk when you eat, because your epiglottis gets confused and you might inhale a French fry, or when people say, oh, it went down the wrong pipe, that's exactly what they mean. So if your epiglottis is down, covering your airway, now that water you're swallowing the water. So you're going to see water in your stomach. So it's all in the same area in the back of your throat, your airway and your esophagus. So you're going to see water in the airway or in the lungs, or you're going to see water in the stomach. Just because you don't see water in the stomach doesn't mean they didn't drown. Another thing that we can look at is the sphenoid sinus. I'm not going to get too much into anatomy, but at the base of the skull, we can actually put a syringe and a needle into the sphenoid sinus and see if there's any fluid in there. Once again, a soft sign. When I say soft sign, just because we don't see it doesn't mean someone didn't drown. And the corollary is true too. Just because we see it doesn't mean someone drowned. So we have to take the whole case in totality and look at it. So if we look at toxicology, right, we can look, I've had people who were intoxicated so much, not only on alcohol and drugs, that they fell into the water, right, with those drugs on board. But did they die from the drugs, or did they die from drowning? Did they die with the drugs? And that's a whole other thing that we have to look at. That's the death investigation part of what we do. So we do the autopsy in a drowning, try to rule everything out. We do toxicology, meaning we're going to take samples of blood, maybe urine, the fluid from the eyes, and test it for illicit substances, alcohol, or even prescription drugs, right? Prescription medications. And then we're also going to look at tissue underneath the microscope. That's a complete full autopsy when you have all of that. Then we put the pieces together, right? We have the circumstances. Now we have the autopsy, what we see grossly with our eyes, right? We're going to look at the toxicology report, and then we're going to look at tissue underneath the microscope. Once we have all those pieces, then we can say, I ruled everything out, and based on the circumstances, this person died by drowning, because there's nothing else, right? But at the same time, we know the condition of Nolan's body. He was decomposed. So that adds a whole different layer to what we can tell from an autopsy grossly with our naked eye or underneath the microscope, because it just might be decomposed tissue.
Yeah.
I know that was a lot. I'm sorry. I know that was a whole lot that I just said.
We need that information, though. We need that information.
Okay.
So it wasn't actually, it wasn't too much. It was a lot, but it wasn't.
Okay.
I think you can never get too much knowledge. But But I
Right.
would like to say this, that like in regards to the decomposition, it are there telltale signs that the body may have been moved to a location? For example, people are saying that, you know, Nolan's body was dumped there. He was saying that, you know, he was probably killed there. He took off somewhere, and then they came back and they dumped the body to make it look like a drowning. Are there telltale signs that you can tell that the body was moved?
There can be, but not in this case. So people know that after you die or someone dies, there's a post-mortem, so after death change that happens. And that's called rigor mortis or rigor mortis, and that's the stiffening of the body. Or there's also lividity or livor mortis, which is the pooling of the blood. So if someone dies and they're on their back, the blood is going to pool and you're going to see it on their back. If they die facing forward, the blood is going to pool and it's going to be on the front. So in some cases, we can say, oh no, that body had been moved because, one, the lividity pattern. If you say somebody, you found them on their back and I look at them and the lividity is all on their front, that doesn't make any sense. Same thing with rigor mortis. If I'm sitting in this chair and I die, my body is going to take the shape of the way I'm sitting. Now, if you move me to the floor and I'm still looking like a dead cockroach, right? Then you know I was moved. That even happens like if someone is sitting in the chair and after they die, then they fall out of the chair. So I can be able to tell that they were moved. Now you take decomposition, right? After about 36 hours, when your body starts to decompose, that rigor mortis I talked about starts to go away. So I can't use that. Plus, the body is, because of the bacteria, the body might change colors. It becomes green, it can become dark red. We won't be able to tell where the lividity is. So we're limited on what we can. So the closer to the time of death that we examine a body, the better we can estimate the time interval. So if someone is dead, you know, they were last seen 8 hours ago, I'd be able to say, oh, that's consistent. But the further you get away from that, I can't have a true opinion to really help about time of death, or even did they die someplace else and then were dumped because of the decomposition.
Yeah, yeah. Can an autopsy actually prove a drowning, or is it a process of elimination?
It's a process of examination. The thing about when we do autopsies, you just can't give us a body and say, tell us what happened. We need the circumstances. And I think that's where, you know, the public sometimes gets confused.
Yeah, that's where I got confused. Yeah, yeah.
Right. Right. And I understand that because it's like, I'm a physician first, right? So we have to ask these questions. And I always say, it's like, if you go to your family doctor and you say, hey, doctor, I have this really bad headache. They're just not going to send you to the OR and say you have a tumor, right? They're going to say, well, how long have you had the headache? What does it feel like? Does anything make it better? Does anything make it worse? That's the type of information that all physicians need to have. But for forensic pathologists, we don't have the decedent to tell us. We have to rely on other circumstances. We have to rely on the people who found somebody. We have to rely on when they were last known alive. We have to rely on their own medical records. We have to rely on the police investigation. The difference between forensic pathology and law enforcement, we are death investigators. We investigate the cause and manner of death. Whether a crime was committed, that's a law enforcement, that's a crime investigation. So we have to rely on circumstances to determine the manner of death. So the manner of death can either be natural, accident, suicide, homicide, or undetermined. So based on the circumstances. So if the circumstances and the scene say that somebody fell down the stairs, that's an accident, right? If the circumstances in the scene investigation or the criminal investigation say they were pushed down the stairs, that's a homicide. The cause of death never changed, right? They're found at the bottom of the steps with head injury. I can say cause of death, blunt force injuries of the head. The manner of death, I can't tell from autopsy. I need the scene investigation to say, how did they get down to the bottom of the stairs? But the thing is, our job is to prove or disprove the circumstances. So someone can say, and I've had a case where someone says, someone picked up a gun. It was a young child, picked up the gun and shot themselves in the head. I look at the body's going to tell us the story. And I'm like, that's not true, because I can look at the characteristics of the wound and say, no, it didn't happen that way. Law enforcement, you need to go back and talk to other people, because this is a homicide in my eyes. So we can prove or disprove circumstances, but we need those circumstances. And sometimes the cause of death is undetermined and the manner of death is undetermined. Right now, where I sit, without seeing an autopsy report, either autopsy report of Nolan Wells, right? I don't know what his cause of death is, but I definitely know, without knowing how he got into the water, the manner of death at this time has to be undetermined. And who determines that circumstance on how he got into the water? That's on the law enforcement side. That's not on the medical examiner side. And if they come back next week, next year, 10 years from now and say, this is how Nolan got into the water, then we can change that undetermined manner to something else.
Okay, and continuing the association with law enforcement and forensic pathologists, when law enforcement has a particular narrative or belief, how much pressure is put on the medical examiner's office to be aligned with that belief or whatever that narrative is? And do they have, and do law enforcement actually have any influence or power over the medical examiner's office?
The medical legal death investigation should be an independent investigation, right? It should be. It should be. Is it always? I can't answer that, right? And we all know there's stories out there, right? I don't know anybody personally, but I've seen people testify in court, and I'm like, did you really just say that? You know what I mean? So I'm not naive enough to say that some of my colleagues do not cave under pressure, right? You look at, there are two different systems in the United States. There's a coroner system and there's a medical examiner system, right? I know in a coroner system, sometimes you have these small rural counties and the coroner knows everybody, right? Or I used to be their doctor, or I grew up with their cousin, and they're not going to rule something a suicide because, the family, I'm going to protect the family and not rule something a suicide, right? Does that happen? Absolutely. Is it correct? No. Our job is to tell the story of the decedent. We have a saying, to the living, we owe the truth. No, to the living, we owe respect. To the dead, we owe the truth.
What's the difference between the coroner's office and the medical examiner's office?
In most cases, the coroner is an elected position and a medical examiner is an appointed position. And I've held both. I was an elected coroner in Ohio, and I was an appointed medical examiner in Georgia. So I had to run a campaign, right? People say, which is the better system? They both have their limitations. They both can be good. It all just depends on who's leading, who's at the head, right? Because they have to set the stage. They have to set the standard of how we're going to operate. I know for me, when I was the coroner and when I was an elected or an appointed medical examiner, I'm going to, advocate for my patient and tell the truth. Their family deserves that. Low on the line, but very important, is I worked really hard to become a doctor. All right. I can't see any circumstance in which I'm going to put my career, my reputation on the line for someone I don't know. So technically, everybody that comes through the medical examiner's office, every person I do an autopsy on, I don't know them, right? But I know that that's somebody's child. I know that somebody loves them, and I know that everybody deserves the truth. Are there physicians out there who can cave? Absolutely, because they're underneath that pressure. Because as a coroner, you want to get reelected. As a medical examiner, you want to be reappointed. So there are some, instances where people fear for their job and their livelihood. So they're going to rule one way or another in order to keep their job or to just be seen as the nice guy.
Could an autopsy determine whether Nolan was injured before entering? Well, you said that. You clarified that. You said an autopsy can determine whether he was injured before entering the water. So the next question would be for me is, could decompensation hide evidence of strangulation, suffocation, or even trauma?
Decomposition can, to a point, right? Like I said, if he was strangled, the bones are going to be broken in his neck. Decomposition isn't going to cover that up. You're going to see that. You may not see anything on the skin, right? Because the skin is now decomposed. I know in the second autopsy, there's red discoloration on the back of his head, but there's no skull, there's no skull fracture, right? So we can see that there's no skull fracture. If somebody was just suffocated, we wouldn't be able to tell, right? Strangled, yes, because you can have injuries of skeletal structures. If somebody was suffocated, we wouldn't be able to tell. But if he was stabbed, if he was shot, we'd be able to see that, even if the body is decomposed. We would also, some things that might not be able to be seen is if there was a struggle, right? Are there any contusions or bruises on his skin or the deep tissue? We may not be able to see that because of the decomposition. It might be there, but we just can't tell the difference. Is this part of decomposition or is this really something? We can look at things underneath the microscope and that might help us, but sometimes it's very difficult. But like I said, I go back to Nolan being a young, athletic young man, right? So I would expect to see significant trauma to his body because I don't believe he would have died of a natural disease before going into the water. So that's what I'd be looking for. Why and how did he get into the water, right? And like you said, could it be trauma? From what I'm hearing, I don't see that there was significant trauma to his body, but that still doesn't rule out how he got into the water.
Let's talk about qualifications. Mississippi allows certain physicians, nurse practitioners, physician assistants, and registered nurses to qualify for county medical examiner roles, subject to state requirements. Is that standard too lax for investigating suspicious deaths?
I would say yes, and there's usually more to it. Like I said, coroners are elected, and coroners are usually lay people. They could be the tow truck driver who decided they want to be coroner. They could be, a lawyer and decide they want to. All they have to do is win the election, right?
How much
medical
is
examiners?
No education involved at all? You don't have no training, no schooling, no nothing. So I could just
I know.
Pull up right now and become a coroner if I wanted to right now today.
Yep, you can win the election in your county and become a coroner. And some laws that require after you win the election that you have to have 16 hours of training every year. Yes, that's the system. That's the system. When I was the coroner in Ohio, you just have to be a doctor, right? But it didn't say what kind of doctor. So I'm a forensic pathologist. I was a coroner, and there's other forensic pathologist coroners in Ohio, but some were OBGYNs, some were internal medicine doctors, right? They're just they can be the coroner. All you have to do is win the election, right? And I'm not sure about Mississippi, but one thing to understand, we have the coroner system and the medical examiner system. Those are just titles, right? So yeah, if you want to be a nurse and be the medical examiner, okay, but you must be a physician, a forensic pathologist to do autopsies. That is the practice of medicine, right? Even though I'm a doctor and I have a license that say I'm licensed in this state to practice surgery and medicine, I can tell you what, you don't want me taking out your gallbladder, right? You do not want me delivering your baby because I'm not trained that. So I don't think that a nurse practitioner or even a doctor, a surgeon, a OBGYN, they can't do an autopsy. An autopsy is the practice of medicine. A cardiologist has a stethoscope, a radiologist has x-ray machines. I have the body and a scalpel and a microscope. Those are my tools. So if you want to be a coroner, you want to be a medical examiner, those are just titles. But to do the work, you must be a forensic pathologist, board certified, I would say, a board certified forensic pathologist.
And what type of education you need to become a board certified forensic pathologist?
Well, one, you graduate from medical school, and then you do a residency, whether in pathology, and that could either be 3 years or 4 years. And then you have a year of just concentrated forensic pathology for a year. So after medical school, you have 4-5 years of training, and then you still train. I don't think you really get comfortable until about 4 or 5 years into practicing after your, what we call it, a forensic pathology fellowship, because you're not going to see everything in a year. You know, people die from totally different, ways. For example, my first electrocution death was after I finished my fellowship, right? So we're always learning. We're going to see different deaths in different areas, right? I have a friend who practices in Alaska. She's had bear maulings. I've never seen a bear mauling, right? But I can learn. So if I ever go practice in someplace else, or different religious, there's some pockets of the United States where they have Amish communities, or people on the Indian reservations, or Muslims, or, Jewish people. We have to learn how to serve our community, right? And I think that's important, not only determine cause and manner of death for our decedents, but how do we serve our communities? And in this case, whether it's Mississippi or Columbus, Ohio, we owe it to our communities to have trust in us, right? To be sure that your medical examiner system in your county is doing it the right way. And what does that come back to? And I don't mean to get on my soapbox. How many people know that you elect a coroner, right? So you need to know, right? So don't go to the ballot box in November and not know you have to vote for your coroner, right? Because we never think about the coroner role or the medical examiner role until it affects us.
Right. What's the difference between qualifying as a Mississippi medical examiner and being a board certified forensic pathologist?
Without knowing the full details, I heard what you said. It sounds like the medical examiner is just the position that oversees the whole system, right? And then the forensic pathologist, death investigators work underneath that person. And it's very important that the medical examiner, as the leader of the office, and the forensic pathologist work well together. I can tell you, I've had cases in my career where my boss did not agree with my ruling. Like if I did a case and I'm like, I believe this is a homicide, and they say it's an accident, then I'm not signing anything where I don't agree to it, right? So, or you think this is a homicide, and I'm like, I think you're going too far, right? Or you want to rule it undetermined just because you think that's the easy way. I don't take the easy way, right? I'm gonna sit down and I am going to once again, advocate for my patient. And then I'm going to get so far, and then my hands are tied. And as the leader of this office, then you take responsibility for that. The cause of death is always going to come from the doctor. Always, always, always going to come from the doctor. The manner of death is going to come from the coroner or the medical examiner.
What records would you need to be presented to you before trusting the official conclusion in Nolan Wells' case?
So in this case, I would want to know if they had a death investigator go out to the scene, right? So if there was a death investigator who went to the scene, I'd want to see their report. I would want to see the EMS report. I would want to see the police report, the entire police report, not the preliminary. I'm going to wait until I get the final police report where I can read interviews and statements and things like that. If there's any video, if there's any videos anywhere, and also definitely photographs. If there's any photographs of the boat, if there's any photographs of where he came from, where he possibly could have went into the water. That's what I do. When I have a drowning case, I like actually going out to the scene myself to say, okay, where did they come in from? Does it make sense that they could have walked down here, or do they come from up there? You know what I mean? I want to see, but those are the type of records I would definitely want before I made a final ruling on anything.
Yeah. What if you had, let's say, two pathologists to examine the body? They examine the same evidence, and one concludes that it was an accident. The other concludes it was a homicide. How does that go? How do you determine? Do you do a third one? How does that go?
So once again, the manner of death is an opinion, right? So both those pathologists are going to have to defend their opinion on why they ruled it an accident versus a homicide. And it just can't just because, oh, I have this feeling. You know what I mean? There has to be evidence that points to that. So what do you have that says this is an accident? What do you have that says this is a homicide? And once again, that's the circumstance that we need. Whether it's in a police report, an interview, whether it's the EMS report, whether it's from the person who found Nolan, right? You know, that's the type of things I want to know. Other things that are also important when we're at an undetermined manner, I would like to know more about Nolan, right? Does he have medical records? Did he? I don't know. Did he have any significant history? Did he have seizure disorder? I don't know. Also, what we haven't talked about, which I can't not include, right? Did he intentionally go in the water? I don't know. I don't know. Did he have any stressors in his life? Those are questions that we ask of all our decedents, right? We don't just ask questions, oh, because this person lived in this zip code, did they do drugs? We ask, I don't care how old you are, is there a history of drug use? Is there a history of alcohol abuse? Are there any stressors? Did you just lose your job? Did your wife just die? Those are very important questions, right? We know Nolan, you know, this is what I know. He was a football player and he's going to college, right? Is everything okay in school? You know what I mean? Those are the types. So you have to talk to people who knows him, right? So I would be having a conversation with his parents, right? Just to find out more about Nolan, get his medical records, get if anything was going on in his life. And I'm not saying this is a suicide. I just want to make that clear, right?
You're just not ruling out anything.
Right, I'm right, exactly. I'm not ruling out anything because I just don't know. But we cannot put our blinders on and say that's not what it is, right? Yeah. Because we have to rule everything out. We have to rule everything out. But that's on how did he get into the water, right? Was he pushed into the water? Did he fall into the water? Did he intentionally go into the water? We don't know. So we have to ask those questions. And if we don't have a definitive answer at the end of the day, then that's why we use the manner of undetermined. Undetermined doesn't mean a crime wasn't committed. It just means we, as a forensic pathologist, we don't have enough information. So I don't want people to think, even if it's ruled an accident, right, doesn't mean someone can't be liable. Those are two different things, right? I've had heroin overdoses where I haven't gone to court, right? I've had cases that I ruled homicide that don't go to court, right? Because that's a legal side, right? What happens on the legal side is totally different than what happens on the medical side. We can have someone, we can rule it undetermined. We can have a cause of death that's undetermined, but based on the scene and the circumstance, I called it a homicide. Did I know how this young woman died? No, because of the advanced decomposition. But I can tell you, this was a homicide. And sure enough, I go to court, right? However it rules, whatever justice is, that's once again not for me to say, right? But of course, as an advocate for my patient, whatever justice they deserve, I want them to get. And also, I don't want anything to go wrong because I did something wrong. You know what I mean? Because we say, I never want an innocent person to go to jail, but I also don't want someone who killed my patient not to, because something I didn't do right, right? So at the end of the day, I'm going to treat my patient, right, as if, we say you talk about the golden rule. I talk about the platinum rule, right? I want people to be treated the way they need to be treated, right? Not the way I think they need to be treated. And so my mother taught me, this is somebody's child. I don't care, who they are, what they did while they were alive or whatever. I want to treat this person as if it was my own loved one, right? I didn't go to medical school to just not do the right thing. So, and I believe, I'm not going to say I hope, I know there's more of my colleagues like me than not. But I'm not going to sit here and be naive to say I don't have colleagues that sometimes don't do the right thing or are afraid to do the right thing.
Yeah, I tend to believe that there's a high concentration of them in Mississippi and other states in the Union, good old boy states. I tend to believe that. But what is the one unanswered forensic question that you would need answered before you would be comfortable with this case going to a grand jury? And I know that's outside of your scope. That's the legal side. I heard you talk about the legal side.
Well, good.
But
Right.
Just take your legal hat off for a moment and just say, what a person, just as a concerned citizen,
Correct.
We want in a safe society.
I would want full transparency, right? I want whatever you have, I want to see it. Whatever you know, I want to know. And I want competent people, people who, like I said, who want to do the right thing. But everything I would need to take to the grand jury, whatever documentation you have, whatever it is, whether you think it's not significant, right? Let me make that decision, right? And then put it in the hands of, the prosecutor, put it in the hands of the jurors, but in order for the grand jury to be able to make a decision, we got to give them all the information. If we don't have all the information to give, then how are they going to make a knowledgeable, decision on which way to go? So before anything is taken to the grand jury, you need everything.
Okay.
You need everything. So, especially you don't have at least I don't know, right? What does the final autopsy report say, including toxicology, right? Nobody knows. No one has said anything about the toxicology. I know there's information about Nolan can swim, right? Just because you can swim doesn't mean you can't drown, right? Did he have anything in his system? So if he was a good swimmer, did he get disoriented underneath the water and couldn't tell up from down because he had substances in his system? We don't know. So until the final autopsy report comes back, that report might have more answers Well, I hope it should have more answers than we have questions right now.
Yeah. So one last question.
Okay.
What grade would you give the medical examiner in the handling of the Nolan Wells autopsy? Mississippi Medical Examiner Stacy Turner. Your turn. A, B, C, D, E. A, B, C, D, E.
I would give it an incomplete right now because I don't know. I mean, it would be unfair for me to assess because I haven't seen their autopsy report. So it wouldn't be fair for me to grade them. From what I know, I don't see anything that's, suspicious from the medical examiner side. They did the autopsy. Dr. Mitchell did the second autopsy. I'm not seeing anything that Dr. Mitchell is saying that there's wrong with the first autopsy. So I would need to read the report, the complete report, not the preliminary report. I want to see the autopsies, the photographs, their cause of death, their manner of death, their opinion, right? So some pathologists write an opinion, especially when it's undetermined. I want to see what information they have. As a forensic pathologist, I know there's information that the public doesn't know. I know that, right? There's conversations that have been had and information that's been shared that we don't know. So until the final report comes out, it wouldn't be fair of me to give this pathologist a grade. That would not be fair. So
you give it an E for effort.
Definitely E for effort, and it's an incomplete right now until you turn in your final project. Right. So I'm going to wait till the final project is turned in before I can give it a grade.
Okay. Well, I can go ahead and give her a grade because I don't have to be as professional. I'm giving her an F minus.
Oh my goodness.
F minus. She's the worst of the worst. And I'm not just giving her this F minus because of the Nolan Wells case. See, remember y'all, when we were in school, sometimes your teacher would give you the curve, that you would make the curve because and upgrade you because you had good effort, or maybe you didn't give the teacher any additional problems. You was a quiet student. You didn't have any behavior issues. So instead of getting that C, you got a B. You know what I'm saying? Instead of getting an F, you got a D. She just bump you up a little bit. Well, in this case, I'm looking at the history of this medical examiner where she has other cases of Black males who died under mysterious circumstances, who were suspected of being murdered by white folks. She has a sordid history for this. And the way this case is evolving, it appears to be on par with her past evaluations and examinations and determinations. And I'm like, yo, I don't trust this chick. I do not trust her as far as I can throw her. So that's my story, and I'm sticking with it.
And that's a fair assessment because you have other information that I don't have. Like I said, I don't know her. I don't know her work, but I would definitely say if there's a pattern, then it needs to be looked at by an independent pathologist. It needs to be looked at because if it's not, it's going to keep happening. Correct. And right. That's why I talk about putting your trust into the system that's in your state, in your county, because I always say it's not if it happens, it's when it happens. And when something happens, when it's your loved one, right, you want to be able to trust that not only are they being treated respectfully, that the person that is doing their examination, determining their cause of death, determining their manner of death, is doing it properly, with integrity. Sometimes people don't want to hear the answers, but if you impart that trust in them, not only in them, but in the whole community, right? Because that's who we treat. We're treating the whole community because we don't want another Nolan Wells, right? I know this is my job, but if I can prevent deaths, I'd be much happier, right? But as long as I'm doing this job, my role is to keep our community safe, right? And if the community doesn't trust me that I'm giving them the right information or the right tools, then what are we doing, right? So if the community does not trust the system, then the community needs to come together to do something, because if not, it's not going to change, right? And we can sit back and have these discussions all day and talk about how many cases of Black and brown men are dying under suspicious causes. Why do we don't want to keep telling that story, right? So we have to take our recommendations off of the paper and put them in action.
Right on.
So.
Right on. I absolutely 100% concur. Ladies and gentlemen, Dr. Jan Thompson Gorniak. I've got to say Gorniak. Gorniak. Hey, I appreciate you for coming on the show. Thank you.
Well, thank you for inviting me.
Especially, and I know I interrupted your day, and this was short notice, but I had to get you on. If I could, I had to shoot my shot. So I appreciate you appreciating me.
Thank you for having me. I'm glad I can lend some knowledge to you and your audience.
It was extremely good knowledge, valuable knowledge, and I appreciate you once again.
Thank you.
All right, fam. Check this out now. I need to give y'all an update. Give you an update. Y'all know the roast of Willie D is going down. It's Willie D, the roast of Willie. Here's a flyer right here. You know what? Let me just bring y'all to the page. This is the roast of Willie D, cooked by legends, hosted by Roastmaster by D.L. Hughley. And we got Cedric Entertainer is one of the featured roasters. And I got a bunch more, fam. I got some of the funniest people in the world that's going to be roasting me at the Smart Financial Center in H-Town, baby, October 28th. It's going down in celebration of my 60th birthday. You dig what I'm saying? Now, this is why I say 60 real strong and loud, fam. See, some of y'all be running from y'all age. Y'all be scared to tell people how old y'all are. I ain't never been scared to tell people how old I am, because many people didn't get to see whatever year it was that I became. Like, it's so many people didn't get to see 25, 30, 35, 40, 45, 50, 60. So I want all of mine. When you see me, don't be like, hey man, how I see you turning 45. No, hell no, man. You just gypped me 15 years. I want all my years because I work for them and I deserve it, baby. I'm taking care of myself. I'm working out, I'm eating right. Hey, I need all of my years. So this is something that's very important to me, fam, because I ain't gonna lie. You know, there were times where I thought that perhaps I might not see these type of days. I think one of the reasons why I'm standing is because I actually envisioned being the old dude sitting on the porch with all of the wisdom and people coming around asking for advice and things like that. I actually envisioned this. And I think just like anything else that you envision, you're trying to pull that girl, you're trying to get that job, you want that promotion, you want to start that business, you want kids, whatever. You got to envision the life that you want. You got to envision the existence that you want. You got to envision the lifestyle that you want. You got to envision the age that you want to live. You know, obviously, you want to get as many days as possible. I say that's what I want, but I want to get as many days as possible healthy. I want to be if I get to 90 and I bust 100 on them, I want to be a healthy 90, 100. It's like I want to be that dude that people say, goddamn, I just got off the phone with him 10 minutes ago. I'm saying, I can't believe it. I want to be that dude. So this is important to me. So what I did, fam, instead of just doing a standard dinner or a regular party or whatever. Since I love comedy so much, and I have so many friends who are professional comedians who really make their money, make a living making people laugh, I feel like, you know what, let me get the last laugh by having a roast and let some of my closest buddies roast me. And then I'm gonna turn around and roast them. Then I'm gonna turn around and I'm gonna hook up with all of my buddies in hip hop, and we're gonna pass the mic. And everybody is going to do one verse of their biggest hit. You dig, fam? This is a night you will never forget. If you can appreciate the type of shows, if you appreciate the type of having the experiences, because this is an experience. If you appreciate experiences, having that under your hat, where you say, man, that was the best, that's at the top of the best things of greatest shows that I've ever seen. I'm right there. I'm gonna be right there in pocket with that. I'm right there in pocket. So if you can appreciate that type of thing, then you want to be here. It don't matter if you live in Houston. It don't matter if you live in Dallas, San Antonio, Austin, Louisiana, Mississippi. You need to get on down to H-Town. It don't matter if you live up top in New York. I got a lot of people coming for this show. I got a lot of people from all over the country that are going to be actually involved in the show, and they're going to be on the dais. But I also have a lot of guests coming from around the country, you know, who are in the entertainment industry, who are entrepreneurs, you know, people who are professionals, you know, like Dr. Jan, you know what I'm saying? You know, they coming out. They coming to salute your boy. You dig what I'm saying? So get your tickets and get your tickets now. The website is Smart Financial Centered with CENTRE.net. smartfinancialcenter.net. Go to smartfinancialcenter.net right now and get your tickets. Get your tickets now while you can get you a pretty good shot at a good seat. Don't wait till all the good seats are gone and then come on here thinking you can get you a really good seat. Because I'm telling you right now, the ballers are coming out. They're going to be out and they're going to scoop those tickets up. So get your tickets right now. Don't take for granted. You'll be able to do it next week, next month. You might be able to get a ticket, but you know, when you walk in and you sit down, after about 5 minutes, your nose might start bleeding. So you dig what I'm saying? I'm trying to let y'all know, fam. I'm trying to give y'all the game right now. I'm trying to tell you how it go right now. Get your tickets for the roast of Willie D, cooked by legends, on October 28th, Smart Financial Center, H-Town, baby. You dig? I appreciate y'all joining the live. Let me do a few quick shout outs because I appreciate y'all. Who is that? Belinda Arbel. What's up, Belinda Arbel? Sonia. What's up, Sonia? Paul. Azur D. Naoki. Nisam. What's up? Is that Nisam? Nessim. I think Nessim. Oregon Sunrise. I like that. Let the sun rise, man. We need a little sunrise around here. A little sunshine around here, man. So much darkness. We need some sunshine. So appreciate that. Who we got here? Sam. What's up, Sam? I haven't seen China Carter, but I'm gonna send her a shout out anyway because she's always working and doing taking care of the moderation duties for us, keeping the trolls at bay. So got to show her love always. Melody, what's up, Melody? Repping the shy. I see ATL. I see Cash P. Houston. What's up, H-Town? Okay, fam, that's my time. Appreciate y'all. Enjoy the rest of your morning, afternoon, or evening, wherever you are in the world. No more talk.